Cardiovascular disease remains the leading cause of death for women, causing 1 in 3 deaths annually. And joining us again today to discuss women's cardiovascular health is Dr. Stephanie Hack. Dr. Hack, thanks so much for joining us.
Thank you.
Thank you for having me.
So we often think of heart disease as a man's disease, but how serious is heart disease actually for women?
Oh, it's incredibly serious. So as you mentioned, heart disease is the #1 killer of men and women. So when we write it off as just a men's disease, then we are preventing ourselves from actually doing prevention and educating women about it.
And Dr. Hack, how does menopause impact heart disease risks for women?
Sure. Estrogen has a protective effect on our heart and blood vessels and many other parts of our body. So once menopause happens and our estrogen levels decrease, we see a rise in things like cholesterol, a rise in blood pressure, and all of those things increase our risks for cardiovascular disease.
Talk about some of those, overlooked, symptoms of heart attack for women, and how are they overlooked?
Definitely. When we hear heart attack, we automatically think chest pain. But in women, they might not present in that same kind of classic way that men do, and they can be more subtle. So chest pain could be chest pressure or chest tightness. They may also experience back pain, neck pain, or jaw pain. Lightheadedness, shortness of breath, nausea, and vomiting are all ways that a heart attack could present.
And talk a little bit about early warning signs that women should pay attention to, even if she is young.
If you have a strong family history of cardiovascular disease, then you really need to pay attention to symptoms. If you have elevated blood pressure, high blood pressure, and it's just not getting lower, that's something else to pay attention to. And then also if you have a history of other chronic conditions like diabetes, or during pregnancy if you had certain complications like preeclampsia, high blood pressure, gestational diabetes, those are all things that say, okay, I might have an elevated risk, I really need to pay attention.
And Dr. Hack, what are some 3 daily habits that women can do to reduce the risk of heart disease?
Well, we're always going to go with diet and exercise. So a heart-healthy diet, which is whole foods, fruits, vegetables, lean protein, healthy fats is good. The recommended exercise is 150 minutes a week. So, 30 minutes, 5 days out of the week. Those are all very good things. Reducing your stress, getting enough sleep, also very important.